have the pleasure of welcoming Dr. Nina Weber from King's College in London. Nina, I don't know if you can hear me. Could you maybe switch on your sound and your video?
Yes, I can hear you.
Hi, fantastic. Hi, Nina. And I think, can you try and see if you start sharing screens, whether we get a exchange of shared screens? Fantastic. Okay. So yes, without further ado, I just want to welcome you, Nina, and you are going to be telling us, I think this is probably the talk I was most looking forward to, because obviously in terms of public policy, I wouldn't want to be the decision maker right now. And this is basically the calculation they have to make, right? This health, wealth balance. So I think we all need to have a listen to what you have to say, so that we can maybe judge our politicians a bit more fairly, whether that's being harder on them or kinder, but we'll turn that over to you. Thank you so much. Take it away.
Yeah, thank you for having me. So I'm part of a research team at King's College London in the Department of Political Economy, and we're looking at people's preferences around the crisis, and in particular around policy responses to the crisis, primarily in the US and in the UK. And this talk's going to be about people's wealth preferences, so how people value essentially saving lives over reducing the economic impact of potential lockdowns. And
Nina, your mic is making a funny noise. I don't know if you want to try and...
Oh, it worked just now. Is it? Okay.
Yeah.
Yeah, so the reason this is an important thing to look at is because as long as there are no pharmaceutical solutions, governments rely on behavioral interventions, and in particular, when there's another outbreak, then governments rely on lockdowns. And any lockdown involves the health-wealth trade-off, because as soon as the economy is being locked down, when we close restaurants or shops, that has an economic impact on people. People lose their jobs, they lose their income, and governments need to assess whether it's worth doing that in order to save lives, essentially. And
sorry, you want to just, I don't want to interrupt you. I feel terrible doing so, but your sound quality is a bit funny at the moment.
I'm not sure what to...
If you maybe put a book under your laptop, sometimes that helps. Yeah, that sounds good already. Let's see how that goes. Sorry to bother you.
Is that better? Okay. Okay, one sec. Let's put this full screen. Okay, so as I said, lockdowns involve the health trade-off, and so governments need to be able to assess whether locking down the economy is essentially worth the economic cost to save their lives. To do that, they use something called value of life, which is a monetary value we assign to a human life that's saved through a policy decision.
Sorry, Nina, we're only hearing half of what you're saying. Do you want to disconnect and then join the meeting?
Yeah, I do that.
Okay.
One sec.
I'm sorry, but it's so important we hear.
Oh, it's my fault. I don't know.
Not at all. And maybe I'll just take this time to say that once again, we're very much looking forward to future work, both with our speakers, people who've submitted posters, and anybody else who's interested in continuing these discussions in the form of workshops. We will be advertising these on our website and obviously sending you details for those of you who've given us your email addresses. We hope that we'll have a couple of themes that you can pick from and join in on discussion, sharing updates with your data, and so on. We've had some also wonderful activity on Twitter, and we look forward to sharing some of that with you when we rejoin the program after lunch. But we have Nina Weber back again. Shall we try out the sound now?
Okay, is it any different?
Perfect. Let's try that.
Okay. It's still, I hope it's still okay, because it started when I shared my screen earlier. Okay. Okay, so yeah, so in order to...
It's the sharing screen, obviously. I don't know why. Do you want to maybe just...
I think it's full screen.
Yeah, full screen. Do you want to just maybe use... Yeah, try that.
Okay, so yeah, as I said, in order to make that decision, governments need to use something called a value of life, which is a monetary value we assign to human life. And even though that sounds very horrible, that's very useful to make cost-benefit analysis essentially of whether something like lockdown is worth it. And then there's also a second reason why this is important, which is that people tend to comply with policies they agree with. And the lockdown is only then efficient if you actually comply with the government guidelines. And so if lockdowns are in line with people's preferences, they're more likely to be efficient because people follow the guidelines.
I'm so sorry, Nina. It's really very crackly. Do you want to maybe try connect? Do you have a mobile phone you could call us on?
Yeah, sure, I can try that.
And maybe you can leave the slides on and then call in on a phone for the audio.
Yeah.
Luckily, we're running perfectly to time, and so this is our first technical hitch, but after 3 days, I think that's doing pretty well. So thank you for your patience, anybody who's watching along. We will be talking with Nina Weber in just a few minutes, and she'll be telling us, I think, some very important information about this health-wealth balance that policymakers, but also the people of those countries having to decide whether or not those decisions have been made in the correct way. I think that this is certainly something that we're all thinking about now, and we look forward to hearing from Nina on this topic shortly. Just to mention again, and I see that we've had some positive response about our workshops already, both from speakers after their talks and now on the chat. As I said before, simply reach out if you have a proposed theme as well. Obviously, I'll do my best to come up with a couple, and I've mentioned some of those today. But if you have any ideas, do drop me an email and we can put those together. As I mentioned, we are fortunate enough not to be bound by space or time, and so we will try for we will try for the end of August to start these workshops up, but we can be flexible. So there'll probably be some doodle polls being sent out to find times that fit everybody's schedules. We have Nina on her iPhone now, hopefully connecting just with audio. Nina, can you hear us? Your iPhone is muted, I think.
Yes.
Okay, I will press.
Okay.
You just need to switch the speaker off on your computer.
Yeah. Okay. Okay, this is new. I hope this works. Yeah, so maybe I can put it in full screen now. Okay, so yeah, I'm not going to repeat everything, but as I said, we need to estimate a value of life to make sure that our policies are in line with people's preferences and that we can calculate whether the economic costs are worth having in order to save lives. And so to provide some background, because it's probably a concept not everyone's familiar with, the suggested value of life by the OECD, which did a big study on looking at different academic studies trying to estimate a value of life, is around $3 million. This is for an average value of life. There's different estimates. So for example, the Environmental Protection Agency in the US uses a much higher value of life, about 7.4 million. And this has been used recently in analysis by economists to see whether lockdowns are actually worth it. They use this EPA estimate, but we also know that these values are very sensitive to context. So for example, there are different studies on how the value of life changes when people, for example, are smokers. So that reduces what value of life people assign to that. And so given that it changes with context, it's really important to estimate a value of life in this particular crisis, because it's unlikely to be something where the value is similar to normal circumstances. And if we just use, for example, the OECD value, then lockdowns are actually not really that effective and not that much in line with people's preferences. So for example, in the UK, we did some calculations using the OECD value, and with that, a lockdown is only very, very marginally beneficial and in line with people's preferences. And so what we did is we did an online survey experiment that I will talk about more in a second to estimate what people's value of life as the preferences are in this particular circumstance. And what we actually find is that in this case, they're about 3 times higher than the EPA figures. So they're incredibly high. In the US, they're at $36 million, and in the UK, they're at 22.8 million pound, which is very, very high. And once you use these figures, lockdowns are actually very much worth it and very much in line with people's preferences. Okay, so provide some experimental details. We did a representative online survey experiment, as I said, in the US and in the UK. And what we did is, we asked people a series of binary choices between household income losses and lives lost. This is a method that is used in economics quite a lot to elicit people's preferences, but we kind of came up with this for this particular scenario. And then people did this, they made these binary choices. I will talk about them more in a second. Then we gave people an information treatment. So either the expected number of deaths in each country or the economic impact. And then people did the binary choices again, and we looked at whether and how they changed. And in the end, we also asked some demographics and attitudinal questions. So we ran a study on prolific academic, and we used quota-based sampling to make a representative of the UK and US population. We were aiming for 2,500 participants in each country because older people are underrepresented on prolific. We didn't quite meet the quota in those age groups. And so we overweigh those responses. Our survey ran from the 17th to the 21st of April, which was the peak in both countries. And on average, so there were a few more tasks involved in that survey experiment. The average completion time was 30 minutes and people earned on average £3. And I'm just going to talk about this particular part of the experiment now, but we had other parts of it in there as well that we're currently analyzing. Okay, so there's a lot to look at here, but if we just concentrate on the United Kingdom on the left, you can see the binary choices that people had to make in our experiment. And as you can see, there's always an option A and an option B. And then going from top to bottom, there are 8 decisions overall. So every person had to make a decision between A and B 8 times. And so if we just look at decision 1 now, with option A and B, we can see that in option A, there are 445 lives lost and £2,700 average disposable income loss. This is one option essentially. The second option is 460 lives lost, so that's more lives lost per million than in option A, and £2,750 average income loss, which is also slightly more income loss than in option A. So any person that wants to minimize the income loss and minimize lives lost per million would here obviously choose option A. Then in decision 2, we have again the same composition, but different numbers. So now we have 412 lives lost in option A compared to 431 lives lost in option B. So still, if you want to maximize the health outcomes, you would choose option A. But now the economic loss is different. So in option A, we have £2,500 average income loss. And in option B, we have £2,420 average income loss. So now option B reduces the income loss compared to option A. And so from decision 2 to decision 7, the option B is always the one that reduces the economic loss, and option A, the one that minimizes the health loss essentially. And then when we get to decision 8, the lives lost are equal, so they're 210 in both cases. But in this case, again, option B is economically the better option because the income loss is lower. So what we would expect is that if someone values both reducing the income loss and reducing lives lost, that they will start by choosing option A in decision 1, and at some point will switch from option A to option B. So if you value lives at the maximum possible amount, then you would switch from option A to option B in decision 8. And so we used the switch point at which people switch from A to B to estimate their implied value of life. And the values in the United States are slightly different because we wanted to make it kind of realistic to the situation at the time in the country, and also make it comparable. So that's why obviously the dollar amounts are slightly different. Okay, so everyone makes these 8 decisions. They then perform some unrelated tasks, and then they get divided into 3 groups. One is an information treatment on COVID-19 deaths. The second one is an information treatment on predicted average income loss. And the last one is just a control where people just hear some music. And then we repeat step 1 and 2. These are the treatments. So they simply receive some information. This was obviously in April, so the numbers are not accurate anymore. The COVID-19 information, the death information is basically telling them that based on the Institute for Health Metrics and Evaluation, if current government guidance is in place, this is the amount of people that will likely have died by the beginning of August. And this is this number of people per 1 million of the population. Then in the income loss treatment, we base the information on the IMF data, and it tells people the expected the expected economic loss essentially in 2020, so as a percentage of GDP. And then we also made sure that this is this gives them some kind of number per person to make it a bit more relevant for people individually. Those are the treatments, and this is very basic first overview of the data. So this is only people who had one switch point in the binary decisions. So we're excluding people that switched multiple times, because multiple times means that they don't have a strict, don't have a stable preference ordering. And we're excluding here people that chose A or throughout or B throughout. And what we can see is that 60% of people switched at decision 8. So decision 8 was the decision with the highest possible implied value of life. There's some people that switched earlier, but really the vast majority of people were only willing to switch to decision to option B once the deaths were hate stable. So what this means in practice is that the values that I gave you in the beginning, the 36 million and the 22.8 million in the UK in value of life, are actually minimum values. And what we then first did before we're looking at our treatment effects is we looked at whether the values people have actually are actually related to compliance, because this is obviously one of the reasons we're looking at this, as I mentioned. And this is what we find there. So we're asking people how likely they are to comply with government guidance. And we can see that in both countries, switching at decision 8, which is the maximum value of life here on the left, increases people's likelihood to comply with government guidelines. So this is the case in both the UK, which is the green line, and in the US, the red line. Then on the right side, the graph is just the switch point. So the outcome variable is moving essentially from, switching at decision 8 or switching at decision 7. And we can see that the later you switch, at least in the US, the more likely you are to comply with government guidance. So the value of life really translates into how likely people are to comply with the guidelines. So this is, as I mentioned, our first result. There's a very high prioritization of health over wealth. We have very high value of life estimates. And we also have a number of treatment effects. And the first one we have is in the UK. We didn't have this in the US. That actually when people hear about the number of deaths in the COVID-19 information treatment, they move from consistent preference ordering, so they switch at some point between decision 1 and decision 8, to choosing option A all throughout. So that means that even when the economic losses are less in option B, which is the last decision, they still remain with option A, which we interpret as something like a tunneling effect, that people, because they hear about the deaths, just get so focused on reducing the number of deaths that they just choose option A throughout. And this is very significant. So we see this both ways. We see on the left side, which is on the left side, we can see that people in the UK move from an all A, so from choosing option A all throughout, to after the treatment having a consistent preference ordering. That's outcome variable. We see that that's less likely in the health treatment for the UK. So people are less likely to choose all A throughout before the treatment and then moving to a consistent preference ordering post-treatment. That's on the top line where it says health treatment, the green line. And then on the right side, the graph, there's the outcome variable. There it is the opposite. So moving from a consistent preference ordering to an all A preference post-treatment. We see that in the UK, again, the green line in the top part with the health treatment, we see that this is more likely. So something about hearing about the number of deaths that are associated with the crisis makes people strictly prefer health outcomes over wealth outcomes in the UK. And then the second treatment effect we have is conditional, and this is the one that's more relevant for policymaking, in that we find that people who underestimate the economic cost of the crisis, they are more likely to reduce their value of life post-treatment. So we ask people before they receive the treatment what they think the economic cost is of the crisis, and then we basically calculated the difference between what they estimated and the number we gave them in the treatment. And we found that people who underestimated it changed their value of life post-treatment. So this is what we can see here. So the outcome variable is whether you moved away from switching at decision 8 post-treatment. And we see that T2, which is the income treatment, and underestimating an income leads in both countries to moving away from the highest value of life. And so this is very relevant for what we're seeing now, and probably by now not that surprising anymore, that once people realize their real economic cost associated with the crisis, they actually realize that there is a trade-off and they move away from valuing lives at the highest possible amount. And this is probably also quite relevant for a potential second wave and a potential second lockdown, because by now the economic costs are much more salient in many, especially in the UK, I would say, but in both countries. And so it's probably going to be less effective to implement a long lockdown in a potential second wave. Okay, so to summarize, I went quite fast now because of the technical issues, but basically we find that people value health over wealth, and with very high value of life estimates that are at least 3 times higher than under usual circumstances. We also find that a high valuation of health over wealth maps directly onto compliance with government guidelines. So people who have a high value of life are more likely to comply with government guidelines. We also find that the salience of the death information, so the number of deaths in a country, leads to a strict prioritization of health in the UK, even at potential economic costs. And underestimating income losses leads to a reduction in value of life in both countries. And so what we're doing right now is we're doing a follow-up survey experiment in late summer, autumn, again in the US and in the UK, where we're going to see how these valuations have changed, because when we did this first study, we did it during the peak of the pandemic. So it was obviously very fresh in people's mind. It was the main topic on the news. And this has definitely changed, at least in the UK, maybe not that much in the US, but we want to see whether these valuations are stable or whether they will change over time. Okay, so that's my talk.
Thank you so much, Nina, and thank you for being so adept at finding a technological solution. We heard you crystal clear, and I think it was very important to do so. So I'm thanking you for being flexible and quick to find a solution.
It's okay.
It was perfect, and your talk was just what the doctor ordered, I think, because I have quite a few questions for you. I wish I could keep you here longer, but what I'm going to try and do is ask questions that first of all, some very specific ones. Did you mention the kind of demographic questions that you asked, and how were they controlled for? Because obviously how important those economic losses are to the individuals is going to weight things quite differently.
Mm-hmm. Yeah, so I don't think I have all the questions in my slides, unfortunately. But so hang on, if I just go back. here for a second. Yeah, so what we did is we only had subgroups on gender, age, region, and employment status. But we also controlled for obviously income. We also had two variables. One was controlling for what the economic impact was on people's life over the last month due to the crisis, and what they expect the economic impact to be in the next month. So we controlled for that. And then we also, we had a lot of questions. We controlled for people's risk preferences, their trust in government, which party they support, and then some general psychological questions like their general trust in people, which controlled for altruism. Yeah, we try to control for everything we could think of.
No, I completely. I mean, that's sort of the way these designs on the go had to be done. And we'd heard about being adaptive, you know, as time points extend into the future. And obviously, you mentioned your longitudinal study. The next question I have is another methodological one, which is your binary questions. Can also be seen as, when asking about income loss, we're really talking about personal loss versus lives lost, which obviously has some bearing on the personal threat. If you see that a lot of people are going to die, it perhaps means that you are more likely to die. But we heard some data that isn't necessarily how it translates. So instead, lives lost is more about collective loss. And so it becomes a slightly different question, really, as they move from option A to option B. And you're now saying also that, you know, as we become more aware of the actual risk to income loss as the situation has developed, whether you've gone on to furlough or whether your entire country is going into either a recession or to depression, clearly this differentiation between personal loss and collective loss becomes a little bit more salient than just health and wealth.
Yeah, I think that's true. So when we ask people to make the decisions, we did give them a little paragraph just about what the income loss actually means. So, you know, we try to make clear that it's not about them personally, but that's obviously people will look at this and think, oh, this could affect me personally more than when they look at the number of lives lost. One thing we controlled for is we had both a fear variable and a personal risk variable, so how much people think they're at risk of being affected by the virus. So hopefully that captures some of it. But yeah, but I think ultimately that's just the nature of the decision.
Yeah, no, absolutely. But I find it very so. I mean, that clarification helped quite a bit, so that income loss was tried to be made more as a collective. But then I have sort of a follow-up question, just as a final one, which is you've obviously done a really nice comparison between the US and the UK, and I'd love to hear your hypotheses as to why you chose those two. What about other countries? I'm thinking specifically about places like South Africa, which had a very intense lockdown measures and very early on, but is a country which is likely to have a much slower economic recovery, and where lockdown, you know, took out so much of their GDP and potential growth for the year. So what do you expect, and do you plan in your further research to have a look at other countries?
Yeah, so I think ideally we would look at a lot of different countries. We were definitely thinking about running it in some continental European countries at the time as well. The reason we chose these two countries, to be honest, is data availability, that we wanted to have a representative sample to be able to actually say this is the value of life people assign in that country. And we didn't have that data available for countries outside the US and in the UK. But I think if we want to say something about other countries, we need to run that in other countries, because there are such striking differences, even in our sample between the US and the UK, that I don't think there's something that these values are something that can be directly applied to other countries. I think I read something that in Germany, for example, the value of life is likely to be lower for the coronavirus based on a survey. But if we can get the resources and we get data access, then we'd definitely like to run it in different countries. South Africa is an interesting idea.
I was just thinking that maybe you could tie in with our previous speaker, Alex English, who was talking about the Chinese situation. And he made that really nice contrast, even within China, between rice and wheat, individualist and collectivist societies. And maybe you guys could hook up and talk a little bit about those subcultural differences, which I think you might even see within the UK, North and South.
Yeah, we looked at regions in the UK and in the US, and there are regional differences.
So I think that would be really interesting to hear about as well. And maybe if we have these workshops, one on cross-cultural differences, but maybe even subcultural differences. And just before we move on to Shane Timmins, who is stepping in for Pete Lund today, we have a follow-up question from Garrett Full, who says, just a clarification, maybe, have you looked at, rather than loss of income, or maybe he's asking for a clarification, was it a loss of job or fear of losing a job? And maybe he's making a distinction between those two things. Did they actually lose their job, or whether they continue to fear losing a job? I think he's asking, I think the question, sorry, is about, from her, is in the follow-up, whether or not you can tie in the fear of maybe still losing your job versus having already lost your job.
Yeah, we had that discussion as well, whether we should talk about job loss or about income loss. And ultimately we chose income loss because it's easier to quantify, and also because maybe it's less, it creates less of kind of a personal fear, and it's better to compare with these lives lost numbers that we're using. But I think there's a lot of things we want to add, and that might be something we want to add. Yeah.
Okay, and then the last question I had, but we really must move on, is we heard about pro-social, positive messaging versus more threatening, and I think that looking at your vignettes, they were obviously quite cold, like quite factual, rather than either being threatening or. But I wonder whether that's something else you could look at, and maybe it's something you can add to the chat to keep the discussion going. But I do have to end with that there, and thank you once again for your time, for your talk, and for adding this more economic aspect to our discussion here at Social Bridges. Thank you so much, Nina Weber.
Yeah, thank you for having me.
Such her email address is there, but also to be found on